But I know you decided to vote no on that Omicron specific booster at the FDA advisory meeting. So can you start by explaining why?
Sure. So the vaccine that was developed by Pfizer or Moderna or Johnson & Johnson or Novavax were all developed to prevent the original strain, the Wuhan strain, the so-called ancestral strain. That strain got replaced. It got replaced initially by a variant called D614G, which swept across Asia, swept across Europe, swept across the United States, killed about 200,000 people here, was replaced by the Alpha variant, was replaced by the Delta variant. Now, that vaccine worked very well at preventing all manner of illness if you'd been recently vaccinated, including mild illness, until Omicron. Omicron crossed the line. Even if you'd been vaccinated or you'd been naturally infected and then you were exposed to Omicron, or now the Omicron subvariants, you were still at high risk of getting a mild illness. So I think that's where the FDA was coming from when they asked us the question, should we include Omicron in a vaccine as a bivalent vaccine, meaning you get the ancestral strain and you also get the Omicron strain. I voted against that for a few reasons. One is when you looked at the data where people who got, say, 3 doses of the ancestral strain, then a 4th dose of the ancestral strain, or 3 doses of the ancestral strain, then the 4th dose being this bivalent vaccine, there wasn't that big of a difference in neutralizing antibodies against Omicron if you got the 4th dose of the ancestral strain as compared to the bivalent. The difference was statistically significant, but unlikely to be clinically significant. Secondly, Omicron's gone. I mean, it's been replaced by the subvariants, BA5, BA4. So the real question is, does the inclusion of Omicron broaden your immune response to include BA4 and BA5? And there was no good evidence for that. We're still waiting for some clinical evidence that shows that getting that bivalent vaccine is of value. And I think if those data come about and we do see those data, then sure, I think we can make that recommendation. But for right now, it just doesn't make sense.